How's it going, guys? My name is Sean. Some of you might know me. Either you're a friend of mine on Facebook or a friend of mine in general, or you've seen me around campus. Who we have here today is Dr. Melissa Klave. She is a former life grad. What is it, like 5 years ago, 6 years ago, 7 years ago?
I'm in my 6th year of practice, yep.
Okay, so 6 years. So a great person for us to be taking information from, because she's not so old that she's kind of a dinosaur, but she's also not too new where she hasn't had some experience. She's definitely very experienced, and just my own experience with her hands are getting better every single time I come in for an adjustment, so it's really cool. Looking into what she's done, so this year 2017, she was Rochester Hills Doctor of the Year, Chiropractor of the Year, so that's a really big achievement. Mm-hmm. She is also a pro bikini bodybuilding athlete. Mm-hmm. She has been adjusting the animals for a while. She actually worked with Purina for a while. Didn't she have a little contract with the Purina? Yeah. So that's huge. Yeah. And so it's a great person for us to take some information from. That's why I was so grateful that she was able to do this for us. Also, today is a very long day for her. She already had a long day of adjusting, and she's sticking around to help us out and do this for us. So very, very grateful to her. So first question, Mel, I wanted to ask you was, what made you want to start working with athletes? Or athletes. She does that too.
Animals. Oh my goodness, good question. I am a dog lover who doesn't love dogs.
Right.
And I started kind of getting interested in college. Now, when I was there, they don't have the program there still, right? Mm-hmm. But they were kind of trying or thinking about it. So there were some professors who actually started adjusting animals when I was there. So I started kind of shadowing, and I just kind of fell in love with, how well they respond to it. I think it's awesome because sometimes when you adjust a patient, it's not like an immediate thing. With animals, it's almost like you can just see it. It's very instant, and that was something that I kind of fell in love with. I loved helping them.
Nice.
So that's kind of how I started.
Okay. How many animals do you typically see in a week?
Obviously having a mostly human practice, you're always going to come across people who don't like animals. So it's not like they're coming in the door all day. So I probably see right now around, I would say it's safe to say 12 to 15 during the week.
Okay, nice.
Yeah.
It's still a lot of fun, though.
Yeah.
It brightens up your day a little bit when they come in, right?
It does. They're my favorite, really.
Yeah, animals are always fun. Humans can kind of suck sometimes.
Yeah. Mm-hmm.
What are your favorite kinds of animals to adjust? And I want you to tell that story about the really unique animal that you adjusted.
Which one? The vertigo one. Is that the one I was telling you about?
You were telling me about a big iguana you adjusted.
Oh, the iguana. Oh, okay. I thought you were talking about my case study. There was a 300-pound monitor lizard. That was one. Not my favorite. Kind of frightening, obviously. Most of the big animals like that, even a lot of the zoo animals, they'll get, they're kind of like rehabbed in the zoo. So that's why, like, people say, why are you ever adjusting somebody like that? Most of them are injured, and they're saved in the jungle, and then they're brought here to be rehabbed. Mm-hmm. And we just kind of fall into place to be able to work on them, which is awesome. My favorite are just the dogs. They're just, that's where my heart is. They get me every time. Yes. Yeah. Yes. Yeah.
So just today she had a champion snuggle pug, right? Billy. He's a little cutie.
Snuggle pug.
And then his cousin Glam, who's training to be, so do they actually do shows? And they come in here to her to make sure that their alignment's good, because that's a big part of doing shows for dogs.
Huge.
I imagine, right?
The gait has to be perfect. So she's kind of crazy. Like, she'll call and be panicking, and she'll say, Glam just jumped off the couch and I gotta get him in because he has a show. And I'm like, okay, I'm sure he's fine, but
Glam's a boy?
No, Glam's the girl, but the other one was the boy. Yeah. Okay. Yeah.
That's a very interesting
They all look the exact same, those pugs.
Okay. If you're wondering why I'm getting so close to the cameras, because I have the questions written here that I wanted to ask her, and didn't want to mess it up. So
I'm staying back here.
So do you ever travel in order to take care of animals?
Sure, yeah. I have done, obviously large breed animals I don't do a ton of, but we're not walking horses through the front office here. So things like horses and cows, and I've done goats. Those are probably the only ones that I've traveled to.
Right.
A lot of the calls for those are mostly for milk production.
Okay.
If milk production slows down, chiropractic adjustments have been shown to help increase that. So, and then horses too, obviously. A lot of them are same as dogs or horses that are shown or raced.
Okay.
And so there is big money in horses, especially winning races. They spend a ton of money to make sure that their gait is perfect.
Okay. So I guess you kind of alluded to it. How much is a typical adjustment for dog, cat, and horse?
Sure. Every practitioner kind of goes, they'll suggest, but it kind of depends on your area. I'm in the middle of upscale Rochester Hills.
Mm-hmm.
There's not a lot of, but there's not a lot of horses out here. You know what I mean? Out where I grew up, there's a ton of that. Yeah. So you can get away with different prices for different animals. Here, with it being a wealthier area, people will pay top dollar because they treat their animals like children. Mm-hmm. I do it for my dogs. I do my prices by weight, and it is cash only.
Interesting.
Okay. So if they are 30 pounds and under, it is 25 cash. If they are over that, then they're paying 40 cash. Okay. We always have the option of doing prepaids, which make it less for them if they choose to do so. Okay. Horses are a whole different story. They are way more involved, so they are way more expensive.
Wow.
Race horses, you can get anywhere from $200 to $300 for an adjustment.
Yeah, the priorities there,
Hands down.
I'm just glad you don't charge me by a pound, because
that'd
be a few dollars.
Don't do that.
All right, so I think, would you say your craziest animal adjustment story is the mana or the monitor, sorry?
Yeah, the monitor, probably that was the scariest one. I've been in the room for some other ones, but I wasn't hands-on. It was more of a learning experience with the big cats and that. I've done a chinchilla. That was kind of weird. I got a patient, a weird phone call.
Is that like a Mexican dish, or is that?
No, that's like the churro, I think. Something like that.
How do you get hooked up with for the horses and the, doing things with the rehabs of the zoo or whatever it might be? How do you get hooked up with those people?
Where I started was, there is a place called, gosh, I don't even know if it's still there. The Devoted Barn was a rescue. Okay. I've worked with a lot of the rescues with animals that have been abused. That's where I started.
Okay.
One, because you kind of have to hone in on your skill as well. And you can't just, it's not like you're, like humans, you get a ton of practice, so you feel very confident. You don't get to adjust them all the time.
Right.
And those animals, I just kind of dedicated myself to starting to feel comfortable around them and going to the rescue and being around them and petting them and feeling their spines. And that's kind of where I started, which was good because it made me, it wasn't somebody's $30,000 horse that I'm messing with.
Yeah.
It was kind of like missionary work. We went overseas for adjusting. These people, they don't have any idea what you're doing, and you get to practice. And it was nice.
Awesome.
It was good.
Cool.
Yeah.
So getting your foot in the door there, awesome.
Absolutely. Yep.
Is there anything difficult about having animals in your practice as far as logistics would go? Or do you have any challenges that come with that?
As far as bringing them into the office, yes, because there's always, like I said, I do it on either my lunch hour before or after work.
Okay.
Because we will have people who say, I'm allergic to dogs, or I do work with a lot of pit bulls and a lot of rescues there. Yes, they're a scary animal, or they have I guess some people are afraid of them. So I try and keep it away from patients. Mm-hmm. Really, that's the only issue that we've kind of had here. Other than that, it's been fine.
Yeah. Okay. Awesome. So there's not any type of health codes or anything like that you have to be aware of or anything?
So health codes, probably not that I've ever dealt with. Okay. As far as malpractice insurance, that's what's tough with veterinary work is it depends with your state. Like in the state of Michigan, I can't advertise myself out there as a veterinary chiropractor.
Okay.
You have to be associated with a vet, which worked out for me. I got very close with a patient that was a vet. Mm-hmm. We established a great relationship. She actually did, she allowed 4 of her animals to be my case studies to get my license.
Very cool.
So when you have a great relationship like that, technically in our state, she has to be a part of that whole process. I can't go out and just say, hey, let me adjust your animal. She's supposed to kind of introduce the whole thing.
Okay, so does she have to be there or make a call, or is it a referral?
If you are following the exact guidelines of the state of Michigan, she should be there. Does she refer me patients? Yes, she does. Is she always here? No, she's not. You have to be careful with those things and make sure that I worked with a lawyer to draft something to make sure that I was protected on my end, because it's a huge gray area in our state. Are there docs out there that say, screw it? Yeah, they do, and they just adjust because they love to, and they know they're helping animals, and they take that chance.
That's helpful. That's good for us to know, though, going forward. But it also kind of touches on the point of, we should be doing this all the time with, and I'm not trying to steal the show here.
No, you're fine.
You didn't come here to hear me, but just making sure that wherever you're going, obviously she developed a great relationship with that veterinarian, and that's served her very well. So you never know where that connection might come in the community, right? Hands
down. And it's something you kind of have to search for, too. Just like finding an MD that loves what you do and is going to refer people to. It's kind of few and far between. I went to 2 vets before that and tried to kind of establish a relationship, and they were like, oh, no, we don't believe in that. So you kind of have to be ready for that, too, which is okay. We're kind of used to that with our profession.
Tough skin.
Yes.
Okay. So we've kind of talked about this before, but do you advise do you have any place that you would advise students to go while in school that they could practice or that they could get their hands on?
And that's what's tough, because down there right now, like I said, I had a professor that was really into it, and so I was able, she had lived on a farm and she had a ton of animals. She worked on her own animals. I was able to watch her, and then unfortunate for Rex, he's my 100-pound big baby, I always went home and worked on him. So he's not very fond of adjustments because he was my practice baby. But of course, you have to start somewhere, you know. Yeah. But down there is, you have to, I would search on both the ABCA and the IVCA and see if there's any doctors in the area. They do list them all. So if you find somebody, if anybody asked me to come and watch me adjust, heck yeah, I would. Yeah. So that would be my best suggestion with that. Okay.
And you kind of touched on it there. So between the 2 certifications, are there only 2, or is it just those 2, IVCA?
As far as I know, those are the 2 that are the largest, the most well-known, yeah.
And can you, just for our benefit, can you touch on the pluses and minuses of either?
Sure.
Obviously, I don't want you to get in trouble with anything, but...
No, honestly, the ABCA, you kind of have to go with how you want to adjust. Now, I am completely opposite as far as humans to animals. Humans, I don't do a lot of instrument adjusting. I loved Activator. I love the protocol for it, but I like to adjust with my hands. Right. With animals, I am okay with adjusting with my hands. I learned all of that, but I see better results, and it's way more accurate adjusting with instrument. IBCA, that's the international one, they teach everything through reflex testing, instrument adjusting, and then going back and doing post checks with reflex. So you really, there's no guessing game at the end of your adjustment. You know exactly if you moved it, everything is balanced, you're good to go. Kind of like with Activator, when we learn, every motion, you could go through every check and is there anything left or not? Right. I liked having that because it's not like I have you to say, hey, it still hurts. An animal, they just kiss you and love on you, Yeah,
they do. Yeah. Okay. So then AVA was a little different?
So ABCA does a lot of manual. I didn't go through them, so I can't really speak on their program. Okay. Price-wise, they were pretty close. In price. I paid about, I think in total, around $2,000. It's not cheap, but totally worth it. Okay.
When did you start that? Was it post-graduation or was it?
Post-graduation. I started. Honestly, I was probably I was really focused on getting my practice up and running, which was a good thing. Yeah. This was something that kind of came in afterwards that I just wanted to
Okay.
Use it to continue my education.
For your guys' information, and this is kind of through the grapevine that I've heard, so validity, I'm not sure if it's 100%, but I'll let you guys know. I've talked to a 10th quarter student while she was a 10th quarter student with us. She's already graduated now. She said that Parker's program there, they will allow you to come and be in that process or go through your certification process. They go on the trimester, though. So usually if you go in and say, I'm in my 10th quarter, you wouldn't be ready yet. But if you just say 10th, they do allow you to take that early.
That's cool.
They don't think about it. So, I mean, I guess it's not really, it's not kind of against the rules, but they've allowed people to do it. So I know about that.
The other thing that kind of stunk was I thought, like, when I signed up that, once you're, I don't know if it's 6 months out, you have to do continuing education as a doc. And I thought, well, hey, if I'm going to put $2,000 into this, then I can get all my continuing education credits.
No,
they don't count.
Oh.
So at least so you make sure your state, it's different in every state. Okay. But in our state, I paid for that and got 0.
Okay.
So, just something to think about.
So you said you do adjust horses. Do you feel like it would make you a better adjuster if you had previous,
hands down,
previous time with horses?
Hands down. Horse people are horse people.
Mm-hmm.
I'm not a horse person.
Okay.
I grew up in the farm, but I was never really around horses. They have a language. Just like I feel like, people are always like, Dad, are you scared you're going to get bit by a dog? I really feel like I know dogs and I know language. With a horse, they are read by, they have a lot of warning signals. Their ears tell you things. They will fake stomp before they kick you.
Yeah.
I don't feel very safe around them, and I never have. And a horse is, you hear people say it all the time, they know when you're afraid, and they act completely different. So is it my number one thing to love to adjust? It's not. It's definitely not.
Okay. So you said that, do animals give you any type of different challenges other than just they can't talk? Is there other challenges that you feel need to be overcome or that you need to be aware of?
Sure. I feel like first visit is definitely the toughest.
Okay.
Because A, they don't know you, and B, they think you're the vet. They come in the room, the door gets shut behind them, I have instruments, So my first thing is I always, before I do anything, and I guess you kind of have to be like an animal person, but I will get on the floor and scratch them and love them, and you have to be okay with that. And it makes, the owner feel very comfortable too. When I go to the vet and the vet sits on the floor with my dog, I'm like, yes, I love that.
He gets it. Yeah.
So I think it's more their fear. And also with instruments, you are dealing with a sound and a feeling that they have never felt before. Just like with a person being afraid to be adjusted for the first time. After the first adjustment, I think that they do a lot better. They're not dumb.
Right.
They can tell. I think the biggest fear for a lot of them is I start behind them, and when I'm feeling near their bum, they think they're going to do, I'm doing the anal glands, and no dog loves anal glands, let me tell you.
I don't.
Yeah. So once we get past that bridge, they're like, oh, okay.
Okay.
It's not going in my booty.
There you go. Okay, so we talked about certifications, and like I said, I'm reading these. Yeah. So I wrote on here, if we have dogs of our own or animals, is there anything we can do to help them as students before we've gone through formal training, I guess I would say, to help them? And again, this isn't a technique club, so we're not supposed to be really giving advice on technique. But is there anything that you think people can look at or just, I guess.
So the two things that you can so I would say learn to see things on your own to know, hey, do they need an adjustment kind of thing. If you take, just like we do leg checks, you can kind of tell if a dog is off balance. If I put my hands underneath their back paws, when the pelvis is off, you will feel a clear difference in weight.
Shifting?
You will feel a lot more pressure on the right than you are on the left. That sort of thing.
Very cool.
That's one thing that I would always do with Rex. The other thing is you're looking for, they give a spinal reflex, and that's what we use with adjusting. the reflex should be very obvious. When a fly lands on a horse, the reflex will go off, and that's what you're looking for. So if you go down and palpate, and on them, it's just like a P to A all the way down the spine. If you get to a spot and it's very aggravated and you're seeing that reflex, that's a good sign to you that something's going on there.
Okay.
So good to look for, at least.
Yeah.
Then as far as adjusting, you can't really do too much on your own unless you know what you're doing.
Okay. Do we see similar neurological changes? Have you done any research on that or seen any type of information on what happens to a dog neurologically or in the brain when they get an adjustment? Have you ever seen anything like that? So
the only thing we look for is, and I hope I'm saying this right, is the paniculus reflex. I believe that's how you pronounce it.
Okay.
That is the one reflex that when you start, it is going to be there. At the end of that adjustment, you go back in any segment that was positive for the reflex. If the reflex is gone, you did your job. Just like with a human, if the legs are balanced, you did your job.
Okay.
That is the one thing we look for, and we hope that goes away.
Cool. So we said no to this one. We're not really familiar with any places near Life that you can go to get shadowing. She said she graduated a number of years ago, so she actually graduated before our Dr. Kara Bradford, or right along the same time, and she graduated a couple of years before Dr. Coach, Dr. Man Bradford, as we call him.
Yes.
Or Beardford.
Yes.
So she's right along there in some of those same years as some of our professors. So a lot of good knowledge to come from this one. We talked about how much you typically charge for adjustment. Do you ever get biters?
I have been bit one time.
One time.
And out of all I see like I said, ton of pits. I have never been shown any type of aggression.
Let me guess, was it a Chihuahua?
It was this little, I don't remember the breed, but yeah, it was probably this big.
Okay.
And you will be able to tell, like, I wasn't even adjusting it yet. All I was doing was an exam. I was just palpating. And you know, their lip, like, starts to, like, and I asked the lady, I said, like, does he have, like, aggression issues? And she's like, no, that's really weird. Well, then I really started to, like, get in there, and it turned around, and it bit my finger. And she looked at me and said, oh, my God, that's so weird. Normally he only bites children. And I was like, okay, well.
As long as it's just children.
I mean, wow. That was the only time, though. Only time.
Hide your kids.
I do suggest, though, a lot of docs muzzle. To me, unless an animal gives me a reason to muzzle it, I will choose not to. If I feel unsafe, that's a different story, but I always hated just because I took my pit in to get his nails done. They said, oh, well, because he's a pit, we're going to tie his face shut. I just don't like it.
Yeah.
You know?
Lame. So I wanted to ask this just because it's been happening with my dog. I don't know if any of you out there have seen this. My dog recently, she moves really well. She's very fast, very agile, but lately I've been noticing when she's running or just walking, she's walking with both feet in the back. Both her hind legs are moving in one. What would that tell you? What do you think that means?
So most of the time with back end, it's going to be pelvis, okay? Or sometimes lumbar region, just like with us. Hard to say, but Gait is going to give you so many indications as to where to look. A lot of times we'll see, like I said, weight distribution will be different. Sometimes you can look at the top of the hip crest and you can literally see through the skin. I mean, most dogs, if they don't have a ton of fur, you can kind of see where those bones are sitting. Yeah. One side will kind of protrude more than the other side.
Okay.
Some other things that you'll see is as far as gait, sometimes instead of doing a forward motion, they will actually do a circle motion on one side instead of just smooth. That's something else that we see a lot. Complaints-wise, the two biggest things that I see are stairs. Can't do stairs. Okay. Or they'll say can't get in and out of the car anymore. Okay. That's like the number one thing, and most of the time it's front end or back end.
That's definitely, Zoe's been doing that too.
Yeah. Yep.
Okay. So how do animals typically get subluxations? Is it like humans, or is the process of a subluxation forming the same? Or because obviously there's not downward axial loading on the spine. So do they get degeneration like humans, or?
Yes, they do get, their spine is a spine. So, degeneration, yes. a lot of the times, like hip dysplasia, right, that depends on breed and upbringing. Cervical, big time, like we preach on having a harness instead of the prong collars or the leashes, or you'll see people do a lot of training and they'll kind of put their dog right next to them and be a constant, like kind of like force on the cervical spine. It's not great. It's not great for them. A lot of subluxations from that. And then it's just the craziness of, like, watch a puppy for a day. I have a puppy right now, and he's like constant wrestle and run around, and he'll run himself straight into the door wall and shake it off, and he's fine. Like, it's going to move a bone. You know what I mean?
Yeah. Okay. So like pole harnesses are probably a good, okay.
Yeah. Way more supportive.
All right. Is chiropractic cheaper than a veterinary visit? Probably. Is that like a dumb question?
My vet visits are, I guess, depending on weight, my vet visits are a cash rate in my office for an adjustment is $50. So for somebody who does not have insurance.
Okay.
And again, I'm not doing, some docs have access to, I mean, we have digital x-ray here, but I'm not taking animals back and doing x-rays. Right. I'm going to leave that to a veterinarian. As I suggest anybody, don't put that liability on yourself, whether you have the equipment or not. So a new patient for me, for a human, is getting an exam and getting x-rays and getting adjustment way more expensive than me doing an exam and an adjustment on a vet patient. Okay.
So what kind of leading into that, how would you distinguish between, okay, my dog needs to be adjusted and, okay, there's something going on and they should be having a veterinary intervention?
Sure. Good question. This is where working with a vet comes in handy. Okay. If there is something, I'm huge on that. And the same with humans too. Don't ever be too proud to say, A, this is way over my head, or B, I need to ask somebody else about this. This is why having relationships with, an MD or a vet is a great option. If I adjust, I would say 3 to 4 times, depending on what they come in with, and I'm not seeing any change, I'm not going to keep them there. Just like with a human, some docs will adjust and adjust and adjust and adjust, and they get the money in the bank. It's not going to help your business grow by keeping somebody there and you're not helping them. What's going to help your business grow is when you help somebody and they feel different and they go out there and they talk about it. So, just something to think about, you know?
That's one thing I've definitely respected a lot about her, is it's never been about, the practice management. It's just been about, I would just say patient management, being really good with her patients. And anybody I've ever spoke to is like, I feel like she takes so much time with us and really, really cares about us. And that's huge. I'll be in here shadowing her and there's questions she's asking her patients. And I'm like, how could you remember that? Like, how would you even, so that's huge, and you can't teach that. So, you can start practicing it though, obviously. What would you say, someone should expect after they take their animal to a chiropractor? Okay. Post adjustment.
Sure. So 3 biggest things are thirst. Okay, they're thirsty. They're sleepy. Okay. Some animals will literally go home and sleep the rest of the day. And the third one is a ton of times. Now, it doesn't have to be. Sometimes it is a constipation patient, and they'll be seen for that. Okay. But increase in bowel movement, and to the point where it's like, they can't, like, I'll get a text saying, well, great, he went right in the vehicle. Thanks a lot, doc, and we'll laugh about it. And I say, well, you brought him here. But they'll have to go, and they'll have to go with, like, 0 warning kind of thing. Oh, wow. Okay.
So grab your brooms.
Yeah.
It's going to be a mess. Yeah. Okay. We kind of talked about it, and I don't want you to go into too much just because I don't want this video to be too long, even though it already is. But statewide rules and regulations. You've kind of told me that Michigan is a state. We're from Michigan. Michigan is a state where a veterinarian has to be overseeing you. Yeah, we're from right here. Yeah. What about, are you aware of any other state rules or regulations for other states? Or
I am not, because I had only came back here. So this was the only one I really cared about. I know that a lot of states are just like this one. We did not go to school to be a vet. Right. So you have to know really your boundaries, and that's why I say I stress the relationship and make sure you do know your rules. I have been in this situation where I had a vet that was not my patient come in the door, and they saw an animal come in the door, and they did approach me, and they wanted to see my license, and they wanted to see. And so when you get yourself in those situations, like you can't just kind of run and hide. You need to know your rules. So if you don't know your rules, make sure you know them before you start practicing, and not just for licensing, but for malpractice insurance as well. If your state is not recognized, I'm not going to call my malpractice insurance and say, hey, can you cover me for animals? They're going to say, no, you're not in a recognized state.
Okay.
So that's where I say having the lawyer relationship and make sure that you are protected on your end comes in handy.
It's always good to have a guy for something.
Yes.
So when it comes to, I don't know if there's anybody watching this that is thinking of having an all animal practice. Do you see that? Or would you have any advice for someone who was looking to do that? Like, let's say tomorrow you said, I don't want to see people anymore. I want to see all animals. What would be your first step towards being successful in that?
Most practices, I have been in 2 practices that are all animal practices. Now, one was a veterinarian, so he kind of saw everything. And the other was a chiropractor that did only horses. That is a very lucrative business, so I think you can get away with it. Now, he works on just the racehorses. So he goes down to Kentucky, and he goes for certain weekends, and he makes $10,000 in the weekend, and he comes home, and that is a different story. I could never see myself doing that because I love what I do as far as chiropractic goes, but it's an awesome secondary to have. Okay.
How would that, and I wanted to ask, so how would that work if you did want to be an all animal practice? Because I've been in contact with a doctor who actually just goes from state to state. But would that mean you have to be registered and licensed in each separate state?
No, and that's where it's a gray area. So you'll have your certificate. It's not like I'm licensed. Like for chiropractic, we take the Michigan jurisprudence. So I am licensed in Michigan. Veterinary doesn't work like that, so that's where that gray area. The guy that I shadowed with the horse practice, he travels to Kentucky. He has his certification just in chiropractic, and he doesn't work with a vet, and a vet is never present. Now, he is 60-some years old. He has never been questioned, and he is one of the best doctors there are. Obviously, these people are paying him hundreds of dollars. He knows exactly what he's doing. However, if anybody were to sue him, could he lose everything? Yeah, you could. So you do. You have to be very careful.
Okay, cool. Anything else that you would, anything else that you would just as a chiropractor to fellow students in general, not even pertaining to animals, but any advice that you have for the students that would be watching this, or people in general that are watching this that aren't chiropractic students, but
as far as veterinary work goes?
Animal chiropractic, but also just chiropractic.
Chiropractic in general. A relationship is a relationship. It doesn't matter whether it is with an animal or a person. My biggest thing is to be relatable. A lot of my friends, and sadly I'm only, in my 6th year out, and there are several of my friends that have already failed, and they are in different careers. My biggest thing is be yourself and be relatable. Don't get stuck on that doctor title. Look what I'm wearing. This is what I wore all day today. You've been here. I wear baseball hats to work. I wear my workout clothes. I am who I am. And that is the biggest thing, whether it's an animal or a person. Just be yourself and don't take yourself too seriously. Yes, what we do, it is an art and it is very serious. But my patients come back because they love not just the adjustment and how they feel, but they love the atmosphere. They love the office. They love the staff. You become a counselor. You have to listen to your patients, and that's what you say, like, how do you know that stuff? I do, and sometimes in my notes I'll even put that stuff in. The small stuff is what matters. Like, hey, Stacy, I know you told me your sister-in-law was in the hospital. That's what makes people know that you care. Yeah. Not just because you're taking their money for an adjustment. Yeah. You know what I mean? Care about them, not just their spine.
And I think you'd probably be much less likely to get sued too if someone
Hands down.
like if someone goes home they're not quite feeling as well as they would have liked to.
Of course.
They're probably going to give you a little bit more grace and more time to more chances, if you will, to get them better than if they don't really trust you, if they don't feel like they have that relationship with you.
Yeah.
Well, I'll just spend a minute or two just bragging on her because she didn't really do very much of that. So I met Mel a couple of years back, like 3 years back. I don't know how long it's been. It's been a few years now. Mm-hmm. And I can honestly say that had it not been for Mel, I wouldn't be in chiropractic school. I had thought about the idea, and I shied away because of the money. So I was in personal training, and I really enjoyed that. And I really enjoyed helping people, but just felt a little bit empty and not feeling like I was getting quite as much influence as far as helping people went. Mm-hmm. And I wanted to be more. I felt like I had more potential. And truly, after hearing me talk about this, we had a conversation, and she was like, you should do it. And she goes, with your background and with your education, you'd have a great success. And she goes, you'll make the money back. And she was very transparent with me, telling me her finances, showing me her budget. And that was a few years back, and you're doing even better than that now. So it's awesome. I'm very happy to see that. I send all my friends to Mel if they're in Michigan. My dad comes to her now. I'm working on my mom. She's just a little bit further away. But truly, I mean, when it comes to, how do we build those mentor-mentee relationships, I didn't even realize that I had one. I'm like thinking to myself, man, how do I find a good mentor? I'm like, all along I had one, and whether it's just before we started making this video, she's giving me tips on, things to adjust, as far as adjustments go and how do you move your hands better. If you look at her, she's not a big lady. She's a very petite young lady. And so for all the females in the group, I'm sure you like to hear that this girl can definitely move a bone, and her hands are like lightning. And I love every time I come in, it feels like her hands are better. But on top of all that, I mean, there is just no one that I trust more to send my family to. And she's not a Gonstead doc. I mean, I practice Gonstead, so I might get in trouble for this. But it doesn't matter. It really doesn't. I believe that there's a lot of cross that we can start having with the different techniques and stuff. It doesn't really matter. All that matters is how much do you care about your patients, and she does to the moon and back. And I'm extremely blessed, and I'm glad that she was able to do this for us. I'm very grateful. And then, like I said, that she changed my life for the better, and now here I am almost halfway through, and it almost feels surreal every time I come in and talk to her. So, so if you don't have someone like Mel in your corner, you can contact her. Would you be open to them emailing you or
questions about anything? Absolutely.
So we will. Do you have an email you can
I do, yeah. My email is adjusting2health, the 2 is T-O, health@gmail.com.
Okay.
Anybody can email me there, yeah.
Okay. And I might tag you on this too on Facebook, so if they decided they wanted to reach out via Messenger, I'm sure she'd be cool with that. Yep. Ask her any questions you have.
Absolutely.
And again, if you don't have somebody like this in your corner, I highly recommend you find somebody that you can just sit down with and talk with, and
find somebody who will give you real answers and not just the sunshine and rainbows, because practice is not easy. You gotta work and you gotta want it if you're going to be successful. That's for sure.
Yeah.
Literally, my first goal when I started that's the other thing too, is write your goals down. My first goal when I graduated was be able to shop at Whole Foods. Like
whole paycheck?
Yeah, right. Right, but that's like a small thing, you know what I mean?
Yeah.
And then you build from there, and then, look what you get. It's God blesses those who really put their life and dedication into a great career like this. I truly believe that.
And she adjusts me for free. So I have that very, very cool perk. So thank you again, Dr. Mel, or Mel, whatever you want to call her. And we really appreciate it.
Absolutely.
All right, guys, I am very excited about this club. Hopefully you guys can all come out and check it out. We don't know what days the club will be meeting yet. We are going to be, me and Ashley and Cheyenne are working on that to get that coming for you. And if you are just someone watching this video who's not a student and you're interested and you want to find out about animal chiropractic or when you should take your dog in, hopefully this helped. And if you want to reach out to her, and maybe she might know somebody in your area, because I know not everybody's from Michigan, but a lot of you on Facebook who are just my friends, you are from Michigan. So if you need someone and you're in the Metro Detroit area, she's in Rochester, and she practices out of we didn't even talk about this, but she practices out of Purdy Chiropractic. It's up by Big Boy at the corner of Rochester and Tinkin, right?
Yep.
So that's another thing. She's an independent contractor, so she's been very successful here. She found a great doc who has great, facility for her to work out of, and she's been able to build her practice that way. So that's another cool thing. So it's someone to talk to who's also been an associate as well. So she's seen both, right? Were you associate ever?
I didn't. I started out as an IC.
Okay, so you weren't.
I never did the associate business because I was honestly, as much as I say money doesn't care, you still need to pay your bills, and sometimes maybe it's just around here it was not worth it. Yeah. So, okay. Yes.
But still, having that information as far as an IC, you are essentially running your own business, but you have to also learn how to work with someone and be diplomatic, if you will. So, anyways, guys, hope you have a great night, and thanks for watching. I know this is a long video, but I hope you got something out of it. Yeah, take care, guys.